Hello guys, we are back again on our channel. Today I would like us to discuss on eye health. Now today I would like us to discuss some signs that are happening to us and we don't know that it's an eye issue, especially those that are systemic and they are related to our vision. The very first one is hypertension. If you are having hypertension and you are on treatment, we'll talk about hypertension. The very first thing that comes to our mind is when your blood pressure is above 130 on 80 or 130 on 90, meaning that is higher than normal. Some people will have high blood pressure that is like 140 on 120. That's hypertensive crisis. If you are having this issue, there is need for you to follow up your treatment because they even lead to death. Those are some of the things that cause some of us to go into cardiac arrest and die without even knowing the cause. At times, it's good to visit the hospital even once in a year so that we check this our vital signs is one of the very important health activities that we need to do. We need to check our sugar, we need to check our blood pressure, we need to even know if we are having malaria or anything that can upset our system just for one. Imagine somebody having hypertension. The doctors they do their best to give you treatment and even give you rendezvous for follow-up. But some of us, we don't go for the follow-up. We don't even take our medication. Some of us will even keep our medication aside and follow up traditional medication. Please, let us learn to follow the prescription of our medical physicians that are being assigned for them to follow up our condition. Also, there is another issue that is one of the systemic issue that can lead to automatic blindness. Diabetes, most of us, we don't control our sugar level. We are on treatment, we just eat anyhow, no exercise. Some of us are even obese, having diabetes, we are no exercise, nothing. You take junk food and add on it, take smoking and alcohol and add on it. These are some of the things that can kill your vision and even kill you just for a day. So an advice for everyone that is a suspect of any of these diseases is that the person should follow the rendezvous and follow the treatment. Diabetes can cause blindness forever because this systemic issue can affect the part that helps you to see, especially the part that controls your central vision called the macula. We need to follow up our rendezvous on hypertension, diabetes, even some autoimmune diseases. Those are having thyroid. Let us follow up our treatment. If you don't even know if you have any of this systemic illness, it's good that you visit at a hospital even once a day, because some of these systemic diseases, they are the ones that will just got up one morning and just condemn our vision because we don't take control of it. Some people, they do it very well because they know their status. Some, they know their status and they don't do anything. Please let us follow up our treatment. Any treatment that they give that you know that is to help you improve your health, follow up. While following up, you pray to God for God to use the physicians that are there or medical directors that are there to solve your problem. Okay, so another, some of us, we are also having arthritis. Arthritis also is an autoimmune. It gives you joint pains, in fact inflammations, some inflammations on their knees, all the abnormal inflammations in the system. Please let us visit the hospital and follow up our treatment. By so doing, controlling your health, controlling your diet, doing some exercises, follow up your rendezvous. With this, at least your body will stay healthy. It will stay healthy, your vision will be clear, and it will automatically stay healthy and nothing will distort your vision. This information goes mostly to those of us that we are advancing in age. Okay, if you are advancing of age, know that your system will be getting weaker and weaker every day. So you need this thing. You go, the doctors will even give you advice on how you need to live and eat. They will give you advice on how you need to live and eat healthy. And you respect and follow those prescriptions, you see that you stay healthy and stronger. And one of the most important advice I'll give is that do exercise and drink a lot of water. Eat